what we know about governance in Africa and governance, well, in many third world countries, and et cetera, does it seem likely that this will be something that they could think in terms of planning and whatever? I mean, and outside of that, then what do you do? I mean, what are some of the consequences of doing nothing?
Well, consequences of doing nothing, you know what the consequences are. A lot of wars, which you know, has already killed millions. You know, the war in the Congo that nobody seems to be talking about anymore, that started in '97 when, you know, Mobutu was overthrown, has taken over 5 million lives. 5 million. Nobody has said anything about it. Yeah.
And yet still there's a population growth, even though 5 million folks have been killed over the last since '96.
Exactly, because the population of Africa has been growing instead of decreasing because two factors: high fertility rate, okay, low mortality rate. There's a lower mortality rate now because of better medical care. So people are having more children that are staying alive than dying. One of the reasons why a lot of Africans, when you tell them, well, why can't you have 1 or 2? They say, oh, no, we got to have 5 or 6. It's because out of that 6, they expect about 3 or 2 to die. Okay, or even 4, living 2. So that's been the reason from if you talk to people in the village, they will tell you.
But now with lower mortality rate, instead of 3 out of 5 dying, they might only 1 out of 5
That's
might
correct.
die.
1 out of 5 might die, or 1 out of 7 might die, living 6. So this, you know, helps the population to grow. Now we've talked about HIV/AIDS. You know, about 20 million, you know, people affected in Africa and all this. But the fact is that HIV/AIDS have crossed, you know, the threshold of fear amongst people in Africa now, like it used to, that people are seeing it as a disease, not a curse, and fighting it and taking their medicine. So the death rate, even with HIV/AIDS, is, you know, stabilizing. Exactly, it's stabilizing. So more people are not dying like they used to initially.
Well, and so Dr. Madu, we've got about 30 seconds before we end this today, but what you're doing, you're really bringing about an alarm in reference to this increased population growth, and even if only other countries can take an example of what is happening in Africa and start making those kind of plans, because while the population in other countries might not be as explosive, we are still having problems in some of these other countries, and so Africa in a real sense can serve as an example of what will happen if we don't deal with the infrastructure and some of the other things that we're talking about here. And of course, let me thank you for bringing that information back, and let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.